Life has not been easy for Paola Moncada in the past year. She lives in one of the largest and poorest barrios in Caracas. She's 14 and already has a 1-year-old son, Josander.
I got pregnant when I was 12. The baby's father left and now I'm living with my mother. But it's not easy because I have 3 other siblings. The economic situation is difficult for all of us.
Paola is now trying to get authorization from the Venezuelan government to get a job in a supermarket. She says she is struggling to feed her child every day.
My biggest fear is that my son won't turn out well, to be a good man. I know that if I don't work, he'll grow up in poverty like I did.
Paola is not alone. According to the United Nations Population Fund, around 1 in 4 babies in Venezuela is born to a teenager. The country has the highest rate of teenage pregnancies in Latin America. The country's political and economic crisis has caused reproductive health standards to deteriorate even more. Paola's neighbor, Jennifer, is 17. She has an 18-month-old son.
I got pregnant because we grew up without the means to take care of ourselves. I did not know I could have a baby, and contraceptives are too expensive and we cannot afford them. Caring for our children is difficult. I don't want my child to be undernourished like so many others.
Hyperinflation makes it difficult to buy food and medicines. Contraceptives are out of reach. That's why people line up in front of this NGO every day.
Clinics like this one receive lots of donations from abroad, and that's why they can provide accessible contraceptives to the population. This device, for example, is about $150 on the streets, while here it costs only $4. The problem is that sometimes they don't have enough.
Dr. Enrique Abache says the crisis is having an impact and that more and more young people are coming here looking for help.
We are giving away what we have, and it's a lot. We're working with the health ministry, but now we're out of contraceptive pills. On the streets, they cost 10 times more, and the people cannot afford it.
Earlier this year, the United Nations launched an emergency program focused on the prevention of violence, but that also provides assistance in reproductive health.
Venezuela has very progressive laws and had several programs to protect and empower girls. The problem is that now the programs are underfunded and without resources. We are focusing on giving away contraceptives, education and prevention.
Paola says she would like to go back to school one day and become an astrologer, but pursuing a dream is not easy in Venezuela these days. Public services have collapsed, and lack of education and reproductive health care are leaving girls exposed to unwanted pregnancies that add up to the difficulties they already endure. Teresa, Jazeera, Caracas.